Hi everybody, it's Adam, the geneticist from Verdure Healthcare, and thank you so much for joining me on my third video on genes that can make your baby sick. So today I am going to talk about chromosome 1 and the 350 diseases it can cause. Yes, you heard it correct, 350 diseases. So, the chromosome 1 is actually here. So it's the first pair of chromosome. Okay, so if you can recall, there are 23 pairs of chromosome in a healthy human. So the first chromosome is the largest out of everyone else. Okay, so because of that, in chromosome 1, okay, in that alone, it has 3,000 genes. Yes, 3,000 genes. Okay, so just in case if you've forgotten the relationship between the chromosome and a gene, let me remind you a little bit. So within our cell, okay, in fact, just like, for example, skin cells, in there is a command center, and within there is the chromosome. The chromosome is pretty much the commander of the cell. So if you unpack that, just like if you untie a ball of strings, you can see the genes inside it. So these are the genes within a human being. But if you want a more comprehensive introduction, I would strongly suggest you to go to YouTube and search Verdure Healthcare channel, and for my video on an introduction about these genetic diseases. I've included the link in the description box below, but the name is Genetic Disorder Dash an Introduction Part 1, and there's a Part 2 as well. So take some time and study through these two videos. Anyway, so because of that many genes, chromosome 1 can cause more than 350 diseases. Of course, some of them are not that common. They might be very rare. I mean, there's more chance of you winning a lottery than getting one of these diseases. So I will just pick a few lethal ones that I'll be sharing with you today. So as you can see, what are these red dashes? So these are the locations of the gene. So they can be very confusing. For example, on I'm sure you can't see it, but anyway, this is 1p36.32.23, something like that. It's very complicated. But anyway, why do we want to mark these positions? Okay, for example, if you do some genetic testing, if we see this bit, for example, this bit missing, then we know, okay, there might be something wrong. So I'm going to pick 5 common diseases, or at least more common ones. Alzheimer's disease, Gauss disease, glaucoma, and PCT, and then prostate cancer. So these are the 5 more common ones that can happen within chromosome 1. So this is the PCT area. Okay, I'll explain what these diseases are in detail later on. And then this bit will cause, okay, prostate cancer. Okay, sorry, this bit. Okay, Gauss disease, glaucoma, and then Alzheimer's. So if we see the region here being missing, then we pretty much know that this person, there is a genetic disease in him or her. Right, so the diseases that we are looking at right now, if you can recall, there are 2 kinds of genetic diseases. One, it would be the single gene disorder. The other one would be the chromosomal abnormalities. Chromosomal abnormality, as I've mentioned before in my introductory video, it is either missing the entire chromosome or an addition of an entire chromosome or something that's swapped around. So I'll strongly encourage you to visit my introductory video. And then, so these diseases I talked about just now, they are single gene disorders, meaning to say that even though there is a region, it signifies a region on that chromosome, they are considered a single gene. Anyway, so first one I would like to introduce you in alphabetical order would be the Alzheimer's. So what exactly is an Alzheimer's disease? Put it in a simple way. it means that the brain cells die and the brains shrink. And pretty much you know what's going to happen afterwards. So the proper name for brain shrinkage is atrophy. Okay, the brain atrophy. So in that case, if the brain continues to shrink, okay, it will suffer dehydration. Okay, it can suffer malnutrition, right, and then it can die because of infection. Right, so this is pretty much the summary of Alzheimer's disease. And then sometimes Alzheimer's can happen at an older age, right? So there are people who get Alzheimer's symptoms at the age of 50 years old, for example, or 60 years old. So by the time it would be too late to realize that, oh, they have this kind of disease, and the first thing they come to worry is that whether or not I've passed this on to my next generation. Right, the second one I want to briefly tell you about is Gaucher disease, right? So Gaucher disease, if you have seen somebody with a very big tummy, why is that? It is because the spleen and the liver has been enlarged so significantly, and it actually bulges out. So these kids are very, very, they are poor kids, and they need treatment for that. So why? Why does this happen? Okay, it is because there is an enzyme called the GBA. You don't have to worry about the proper name for this. If you are interested, you can search GBA, the enzyme called GBA. So because of the lack, meaning to say missing this GBA enzyme, the body cannot actually excrete or treat harmful substances that builds up in the liver. So the liver is getting poisoned, to put it in other words. So it can go all the way up to the spleen, to the bones, and to the bone marrow. And these, the lacking of the GBA enzyme will prevent these organs from working properly. Okay, so what are the symptoms if you get Gaucher disease? For example, bone pain and fracture, impairment, okay, the decrease of thinking ability, cognitive impairment, we call that, easy bruising, enlarged spleen, liver, the kid might feel very tired, heart valve problems, that is not so nice, lung diseases, seizure, and severe swelling during birth, like for example, the baby's getting really big at birth, and then skin changes as well. So these are some of the most common symptoms. So what is this thing? So this is the molecule for GBA. So that's what GBA looks like. Okay, anyway, so moving on to the next disease, glaucoma. Glaucoma in Chinese we call it 青光眼. Right? So I'm sure some of you might have heard of this before. So what's happened here? So, okay, this is the eye and this is the optic nerve. So when there is a liquid built up in the eye, it's going to pressure the optic nerve. And as a result, you are going to lose your vision, okay? And then, okay, PCT. So this is a skin disease, right? So whereby with this one, it looks like you get blisters when you expose this part of the skin to the sun. So that's pretty much what's going to happen during PCT. And then of course we have the prostate cancer. So chromosome 1, that it contains a prostate cancer gene, that if you have a mutation in that, obviously it's going to increase the risk of having the prostate cancer. So how do you know if you have a prostate cancer? Of course, if you feel like you can't, empty your bladder, there's still, after you went to the toilet, you still feel that there is this kind of, pressure feeling in your bladder, then you need to be careful. So because if, let's say, there is a prostate cancer, it's going to take up space in the prostate, and that is going to pressure the urethra, right? So these are the stages of the prostate cancer. At the first stage, it pretty much feels like nothing. There's just a piece of tumor in there, and it is extremely hard to detect. So afterwards, at stage 2, the tumor starts to grow. And then at stage 3, it starts to take up the seminal vesicle, which is located here. All right, and then seminal vesicle, it produces the liquid for the semen, and then at stage 4, it pretty much will spread to the lymph nodes, and it will spread to other parts of the body. And just to share with you, the spreading of the cancer in medical term is called the cancer metastasis. Okay, right, so yeah, since it is so hard to detect, the only way to know what's the risk of you having a prostate cancer is by doing a genetic test. So with all those diseases, so even though I've only mentioned 5, and in my future videos I'm going to further focus on each and every one of these diseases in more detail, so please do look out for my future videos. What are their treatments in general? Okay, if we were to take one step back and we have a look at the bigger picture, how do we treat genetic disease? Honestly speaking, for genetic disease, at this moment, there are not much cure, if none at all, if not none at all. Okay, so for mutated genes, one fantasy treatment would be transplantation to replace a working gene, or sometimes called the gene therapy. Mutant protein, replace that protein, or we have some medicine for that. Metabolic malfunction, organ malfunction. So for these ones, we can only do some diet modifications, or sometimes surgery would work to replace some of these organs. But they are extremely difficult to execute, and then the chances of success is actually very low. So in that case, I would strongly recommend to prevent genetic diseases from happening instead of thinking how to cure it. So in that case, if you have some family members having such diseases, then you should really be aware, because along the same family line, it can pass on to you. Even though if you are not affected by the disease, for example, you are okay, but still there is something called a carrier, which means you might be having the gene, except that it doesn't have enough power to cause you the disease. So how do we do that? Okay, through a genetic testing. At Verdure Healthcare, we have something called the PrePregnancy DNA Screening. So if you're not planning to have a baby, it is often quite difficult to walk into a clinic to get yourself genetically tested. Yeah, I understand that pretty well. So if you are planning for a pregnancy right now, then for the sake of our next generation, you should come and do this particular test, whereby we'll be checking you and your partner to see if you're carrying any kind of these diseases. Being a carrier is not really much of a big deal as long as you and your spouse are not carrying the same kind of disease. For example, if you're carrying Alzheimer's disease and your spouse is also carrying the Alzheimer's disease gene, then when it comes together, there will be a 25% chance that your child will be affected by Alzheimer's. Right, so for the reports, this is exactly what you'll be getting. So first of all, as part 1, as we have mentioned in previous videos, you would be getting a report on your chromosomes to see if there's anything wrong at that particular level. So this is the part 2 of our pre-pregnancy genetic test report, whereby we'll be able to see what kind of genetic mutations that you are carrying. So this is one live report that I've received back a few weeks ago. So this lady, it's a lady, carrying beta thalassemia, Smith-Lemli-Opitz syndrome, and then Wilson disease. So she is carrying 3 diseases. So the key is whether or not her husband is carrying any one of these. So unfortunately, her husband was carrying beta thalassemia. So in that case, what can we do? So since they are not being affected by the disease as they are only carriers, we boost up their fertility health by increasing the quality of their sperms and eggs, and then we send them off to IVF. But that's not it. At IVF, when the baby or the embryo has been made, we would send the embryo for genetic selection. It's a very stringent process whereby we take a part of this embryo to go for the genetic testing to see whether or not this embryo is carrying beta thalassemia and other genetic diseases. And it's a very expensive process. That is why we do this test to let you know whether or not this technology is something you should be doing. Okay, so I understand that this is very complicated, so you might want to go through what I've just said one more time. Basically, the reports need to be analyzed by a professional. So, for example, like for myself, I was graduated from the Royal College of Surgeons of England, getting a postgraduate certificate in surgery. So I'm qualified as a surgical instructor. But if I were to talk to you about genetic tests, that's not enough. You need additional training. So yeah, in Malaysia, if you are a doctor, if you are a healthcare professional, you can speak of genetics. But we want to make sure everything has at least a minimum standard. Sorry to say that, but yes, I've obtained my qualification from Stanford Medical School, but as the processes are getting more strict in the US, by the way, we follow the US system, if I were to offer you genetic tests like the PrePregnancy DNA test, I would need to get another level of qualification. That's why I got Harvard Medical School genetic testing and sequencing technology certificate from them, yeah. And then also genomic data science, because analyzing these data is in fact quite headache. Okay, so you need a system in order to put these data together. Only then we are able to plan the most suitable fertility solution for you. And we take into account of your hard-earned money. We don't want you to waste your money doing something that is totally unnecessary or it will be useless. Okay, so after getting all these genetics checked, what can you do afterwards? So whether or not you are carrying any kind of mutation, we would enhance the quality of your sperm cells and egg cells. Because even if you go to IVF, you need good quality sperm cells and egg cells to pull through the process of the embryogenetic selection. So we have a lot of supplements that can help you do that, and our products has just won the Baby Talk Mama Papa Magazine's Reader Choice Award 2021. And okay, including our VHC formula Female 1 and Female 2, and these are focusing on increasing female fertility, including the egg quality and the reproductive system in general. VHC formula male, whereby we can increase the quality of the sperm in terms of the quantity and the quality, swimming capability, as well as the shape of the sperms. And then our confinement 1 and 2 has also won this Reader's Choice Award 2021. And so this is mainly for if after you delivered the baby, we will help you recover through the supplement, or if let's say you've suffered a recent miscarriage, this can also help you getting yourself back on foot again for another pregnancy. And so I would really like to proudly say that because of our practice, Verdure Healthcare has been awarded Super Brand Malaysia's Choice 2021. So 2021 has been a very exciting year for us, thanks to all of your support and encouragement and your trust. If not, we will never be able to achieve this milestone. So thank you so much. Anyway, so step 3, after you've enhanced your sperms and egg cells, the step 3 would be to conceive, whether by natural pregnancy or via IVF. If you don't need IVF, okay, we have something called the home artificial insemination IUI, and all you need to do is just to follow 3 steps and you can complete IUI at home on your own. Right, so and that is only at 1/50th price of an IVF. And you don't have to go to the hospital, you don't have to buy a lot of equipment, okay, and because that component will be providing you, the IUI kit is rewashable. You can do it 10 times or 100 times if you want. So only 3 steps is needed. The first one is to grasp your menstrual cycle. So you need to understand when are you going to ovulate. So if you do it at the incorrect time, then pretty much your effort will be wasted. So when you ovulate, there will be a temperature bump because of something called the LH surge. LH is an ovulation hormone, and then when it surges, your body temperature will bump up a little bit. And you need to use a thermometer, a very sensitive thermometer, which is available at Watson's and Guardian. And then you'll be able to do the testing, and then you'll be able to predict when are you going to ovulate. And you can confirm ovulation by using our LH ovulation test kit, so which is included in this IUI package, whereby if you've tested positive for ovulation, you will be able to proceed using the baby maker kit, which is IUI kit, to get your partner's sperms and inject them directly into the uterus. And that means it will give the sperm cells a shortcut, and then it propels the sperm cells directly to find the egg. Right, so using this component, there are only some very simple steps. Assemble it, and then collect the sperm cells, and then inject them into the reproductive organ. So this is particularly suitable, especially when the male partner has a low sperm count or has poor motility or abnormal shape. So of course, I would strongly suggest you, if you are under these conditions, to use our VHC formula male to boost that up a little bit, and in turn that will even increase your chance of conception even further. And for ladies, if you're suffering from high amounts of antibodies, or suffering from recurrent genital infections or pain during the intercourse, then this is suitable for you. Right, but okay, if let's say you are carrying some genetic mutations, then the solution would be to go for embryogenetic selection, just like the case I told you just now. Okay, how does this work? When you go to an IVF, you see the doctor. When you accept the treatment, he will do some exams with you, some physical examinations, a blood test, and then you would take the stimulation medicine home, and then you would inject yourself with the medication. On the suitable day, you go back to the hospital to retrieve your eggs, and then they will put that together in the lab. When that happens, we will need to wait about 5 to 6 days for the embryo to actually mature a little bit. When that embryo matures, before they put it back into the womb, they will run through a genetic test. It's called the pre-implantation genetic screening, and there's also another technology called the pre-implantation genetic diagnosis. So diagnosis and a screening. Right. So as you can see, this is about the process of doing it. So there is a chance for the embryo to be hurt a little bit. Okay, there is a chance because after all, you are taking bits and pieces off the embryo. And then, so that's why we need to enhance the sperm quality and the egg quality so that they can pull through this process. So many people would ask, Adam, if that's the case, if this technology is so good, why can't every couple just go for the pre-implantation genetic diagnosis and screening? Okay, another problem is money. It is very expensive. If you go to Google and search cost of PGS-PGD in Malaysia, just put that there in Google, you'll be able to see that this will come to a cost of around 35 to 50,000. So it's your hard-earned money, and at Verdure, we are responsible for planning the most cost-effective and effort-saving method for you to achieve your dream of having a healthy child. So at Verdure, we have a number of partners, including our DNA test lab, it's DNA lab and genomics lab. BP and Path Lab are our panel as well, along with Alpha Fertility, TMC Sunway, Thompson Hospital, even Sonovision and Gribbles, okay, are our partners. So pretty much the majority of the big healthcare players are part of our Verdure's network. So we will be able to provide you with the best advice on the next fertility solution. And yes, I hope you can take away this sentence from this session. Your genes determine your baby's lifetime health. So as I mentioned once again just now, the cure for genetic diseases is still very immature. So let's not wait for that to happen, since we can prevent it now. So do this test, know what are your genes, and then we'll plan the best fertility solution for you. So please do give us a call. We look forward to hearing from you. And then this video would be put on YouTube channel, so under the same name, Genetic Disorder Chromosome 1. So do search for that after this Facebook premiere session. Listen to this video again, and you will pretty much take away even more things from the first time you hear it. So please do support our channel, subscribe, share this video, and like this video. Thank you so much. I will see you next time.